Managing body weight. In this chapter section, what we're going to do is learn about evaluating an individual's weight and risk factors to determine whether weight loss is recommended. We're going to talk about the recommendations for the rate and amount of weight loss. We're going to distinguish between a good weight management program and a fad diet. And when you watch the video this week, that's going to help you as well. And we're going to learn about how medication and surgery can promote weight loss. So what is weight management? We've talked a lot so far about managing body weight to stay in a healthy range. And really what it is, it's a balance between energy intake and expenditure. This requires us to make healthy food choices, control our portion size, and maintain an active lifestyle. And managing your body weight to keep it in a healthy range requires a conscious effort for some people. For some people, it may mean just avoiding weight gain as they age and making healthy food choices. For others, it may mean making major lifestyle changes in order to reduce their weight into the healthy range and keep it there. So how do we determine who would benefit from weight loss? So these days, almost everyone I meet wants to lose a few pounds or more, but not everyone who is concerned about weight needs to lose weight in order to be healthy. There are risks associated with carrying excess weight, and they're related to the degrees of the excess weight and where that excess weight or fat is located, and the presence of other disease or risk factors that often accompany the excess body fat or body weight. So weight loss goals and guidelines are for overweight or obese people. The goal for them is to reduce the health risks associated with their excess body fat. So initially, the general recommendation is to lose 5 to 10% of body weight within 6 months. This amount of weight loss can lower blood pressure, reduce the risk of developing type 2 diabetes, improve blood cholesterol profiles, and reduce the need for medications to control blood pressure, blood glucose, and blood lipid levels. After 6 months, risk factors can then be assessed or reassessed to determine the need for additional weight loss. What we do know is that a pound of fat or adipose tissue provides about 3,500 calories. So losing a pound of fat requires decreasing intake and or increasing energy expenditure by this amount. The approach that is best for an individual depends on personal preferences and his or her readiness to make lifestyle changes. So whatever the approach, losing weight slowly at a rate of about a half a pound to 2 pounds per week helps ensure that most of what is lost is fat and not lean tissue. The more severe energy restriction needed for rapid weight loss leads to greater losses of water and protein and can cause a significant reduction in someone's basal metabolic rate, which is not really what you want to do when you're trying to lose weight. You want your basal metabolism to be at its best. So successful long-term weight management requires changing the behavior patterns that lead to weight gain in the first place. So people who cut calories to lose weight generally achieve a maximal weight loss at about 6 months, after which they may regain some or all of the weight. So this weight gain often leads to repeated cycles of weight loss and regain. This is a visual representation of the weight cycle, and what it shows is managing weight is an ongoing process that requires long-term changes in lifestyle, and often this pattern of repeated cycles or weight cycling or yo-yo dieting occurs. And we used to think that this cycle increased our visceral fat storage and would make future weight loss more difficult, but current research is showing that the benefits of weight loss outweigh any risks associated with weight cycling. So basically what that means is we need to continue to encourage people to lose weight, even if it's a little bit and it comes back, because the benefits outweigh the risks. But we really need to teach behavior modification, combining diet, activity, and behavior to get the best results in long-term weight maintenance. So how do we modify people's behavior? So part of what you're doing right now, education. So to change food consumption and exercise patterns, we have to also identify patterns that lead to weight gain and replace them with new ones that promote and maintain weight loss. It really is a lifestyle change. So we know that balancing your intake and output, cutting down on calories, and increasing physical activity are the main components of this modifying behavior. So here we see it. We usually have people keep a log, and that's what I've had you do, where you eat and drink and how you feel, and this identifies patterns of excess intake or overeating. Then once people recognize this behavior, that they're snacking on high-calorie foods or portion size, and they eat more intentionally, and we can identify behavior changes or foods to change. And then we can feel the consequences. The long-term consequences we know can be weight gain. In the short term, it can be guilt and remorse. You're managing your weight. And so modifying that behavior is number 4, recognizing it and taking small changes. And then the new consequences are enjoying the improved self-esteem and weight loss that accompanies it. So those are the ABCs of behavior change. So the antecedents, the behavior, and the consequences. So gaining healthy weight. So not everybody wants to lose weight, and there are many people who desire to gain weight and have a difficult time gaining weight. And most of the time, this is genetic or hormone regulated, and they may not be able to gain weight. So often, these people get a medical evaluation to make sure that they don't have any medical issues associated with their challenges for gaining weight. But oftentimes low body weight is due to low energy intake or high energy expenditure. So gradually increasing the consumption of energy-dense food is what we suggest. Energy intake can be increased by eating meals more frequently, adding healthy high-calorie snacks such as nuts, peanut butter, and milkshakes between meals, and replacing low-calorie drinks such as water and diet beverages with 100% fruit juices and milk. What we do is we try to encourage gain in muscle rather than fat. So muscle strengthening exercise should be a component of any weight gain program. What I tell people, it's actually the exact opposite of what you do to lose weight. All the things that people are doing to lose weight, avoiding energy-dense foods, and increasing portion sizes, losing weight, you want to decrease portion sizes, and you definitely want to make sure you don't skip meals. So what about weight loss diets or fad diets? So we see all of these advertisements, lose 10 pounds in 5 days. Who wouldn't want to? So people are so desperate to lose weight, and they're prey to all sorts of diets that promise quick fixes. They're willing to eat a single food for days at a time, select foods on the basis of special fat-burning qualities, and consume odd combinations of specific foods at certain times of the day. But most diets, no matter how outlandish, will promote weight loss because they reduce energy intake. So even diets that focus on modifying fat or carbohydrate intake or promise to allow unlimited amounts of certain foods work because intake is reduced. The true test of effectiveness of a weight loss plan is whether it promotes weight loss that can be maintained over a long period of time. And people often don't recognize that if you lose weight, you need to eat less to stay at the lower weight. And that's an important part of an effective weight management program. What we know, the programs that are affected promote healthy weight loss diets and encourage changes in the lifestyle patterns that led to the weight gain. So when you're selecting a weight loss program or someone's asking you about it, you want to distinguish between the healthy diets and fat diets. So healthy diets promote a healthy dietary pattern that meets needs, including a variety of foods to suit the preferences, and can be maintained throughout your life. So you can't go on a diet that says you can never eat carbohydrates again because you're going to want to. It promotes reasonable weight loss, half a pound to 2 pounds a week, and doesn't restrict energy to under 1,200 calories a day. It includes physical activity. It's flexible enough to eat out when you need to and be part of social circles. And the foods need to be easily obtained, that you don't have to go to a special store or order them online. It doesn't require costly supplements. Promotes a change in behavior, teaches new eating habits, provides social support, and it's based on sound scientific principles that may include monitoring by qualified health professionals. So common dieting methods look at a variety of forms, but that needs to be managed around food guides, to manage various food groups, to meet the dieter's goal, and that meet all the micro and macronutrient needs. Moderate to high protein diets are very popular right now, and where you increase your protein intake to 25% or more of calories. So you got to be cautious of those. But we do know that the little bit higher protein does promote satiety and preserves muscle mass, but it hasn't been shown to be more effective than any other calorie restricted diets. And low-fat diets, they've been around for a long time, reducing the amount of fat, or liquid meal replacement diets. Carbohydrate restricted diets, we know that just like the high protein, low carb, low fat, liquid diets, food diets, they all have their benefits by reducing calorie intake, but it's something that you can continue doing for a lifetime. So what about weight loss supplements and medications? So the purpose of those are to reduce your appetite by affecting brain neurotransmitters. Phentermine or Adipex is one of those. There are some that decrease the fat absorption in the intestine, for example, Orlistat or Xenical. And usually these are only recommended if your health is seriously compromised by body weight. But the disadvantage is once you discontinue those drugs, the weight gain it usually comes back. Over-the-counter weight loss, Ali is a very common one that is sold, and what it does is it interferes with the absorption of fat-soluble vitamins. So when you eat fat, it's actually excreted in the feces sometimes when you're least expecting it. Remember, weight loss supplements are not regulated by the FDA. They contain fiber that help you feel full. Fat burners have been banned, and there's all kinds of Dr. Oz, I always say he went to medical school in the land of Oz kind of recommendations. So make sure that that you're taking something that you know is scientifically sound. Weight loss surgery, probably heard of, adjustable gastric bands, gastric bypass, liposuctions. Be sure you know a little bit about all of those. There's some pictures of the different types of surgery, and there's a lot of debate whether this is a good solution to obesity or not. But what you can see here is that Al Roker in the Day Show lost 100 pounds after going through gastric bypass surgery, and he